Well, what do you know? We have a reprieve until Easter. The president will not have a health care bill on his desk, at least before the end of this month. That gives us time to propose what I think has to be done. The Congress doesn't understand the structure of the medical profession, and it's absolutely necessary that primary care be made much more robust, that the primary care doctors in their offices do procedural work. That means that they staunch a bloody nose or do minor surgery, take cardiograms, remove wax from the ears. Currently, all this stuff is being farmed out to specialists, and the bill is multiplied maybe 100-fold. A patient has to see sometimes 3 specialists to get done what a doctor can do in his office. There's no doubt in my mind that unless primary care is straightened out and made uniform throughout the country, that we can't have a proper health care bill, to say nothing of proper health care or medical care. So what I propose is that they scrap the current health care program, and they deploy over the next 2 or 3 years at $100 billion a year, 100,000 primary care centers of America. All the details for this can be seen on my website, the-public-option.com. The reason for this would be so these primary care centers would employ primary care doctors. The federal government, being an employer, can dictate the terms of employment as well as the job description of the doctors. The big fly in the ointment to date has been the litigation, the fear that primary care doctors have of litigation. As a result, they do no procedural work in the offices in general and refer patients out. That multiplies the bill. The only way primary care can be solidified is if the primary care doctors, enough of them, were employed by the federal government and followed the job description of primary care as set down by the federal government. That means that there will be a public option, and the public option will be the primary care centers of America, or doctors in private practice who are willing to follow the job description of these other men. Litigation will be reduced considerably for federal employed physicians because of the Federal Tort Claims Act, and the defense attorney in that case would be the Office of the Attorney General of the United States. The details of this plan are seen in the website I've cited to you, and it's very important that you view the website in conjunction with what I'm saying now. I need your support. The nation needs your support. The current health care bill is simply putting off the catastrophe the Congress thinks it's facing currently or today, that they won't be able to pay for Medicare and Medicaid, and they're forcing young Americans to go into a system that they don't want and they themselves can't afford. So look at the website, get hold of your representatives, and see if we can pierce the curtain that divides those of us being governed by those who are governing us. I think this is sort of an emergency. Get to it. We only have till Easter. Hopefully, the president will fail at Easter time, and we'll have a little more time to work on the public option. Thank you very, very much